In Good Shape, your weekly dose of health information on DWTV. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition and beauty. Medical professionals, therapists, and counselors are in our studio every week to offer their expert advice on In Good Shape.
Joining me today is an expert on aesthetic dentistry, Professor Robert.sader from the University Hospital in Frankfurt. Thank you very much for being our guest today.
Hello, and thank you for the invitation.
Professor Sader, how much of a whitening effect can you expect when you bleach your teeth?
In aesthetic dentistry, we consider the color in objective color scales, and with bleaching, you can change the color in about 2 to 3 degrees.
So 2 to 3 degrees whiter than the color you have, sort of thing?
Exactly, yes.
And how long does this effect last?
This, of course, depends on individual behaviors of the patient. Yeah? Whether he uses a good oral hygiene and whether he avoids to drink substances which change the color, like red wine or tea or coffee. But if he takes care, then the effect can last about 3 to 5 years.
Okay. We've had a viewer writing to us. David Okua from Ghana would like to know if bleaching works for everybody. What if you've got sensitive teeth, for example?
Of course, bleaching works for everybody, but not in the same way. It depends on genetic factors and on the individual color. If you have sensitive teeth, then you have to take care for the neck of the teeth, but normally the dentist does it in a good manner.
But isn't bleaching harmful to the teeth? You'd imagine that you bleach away some of the enamel. Isn't that something that would harm your teeth or gums?
Normally not. Of course, you are right that the bleaching substances, they change the structure of the enamel for about 2 weeks. Yeah? In this time, you have the risk of increased abrasion, but after that, it's completely normal.
What about those over-the-counter bleaching sets that you can buy? How effective and safe are they? Would you recommend that?
There have been lots of tests on these substances, and of course they have an effect, but a very small one. So if you make a cost relation, then I think going to a dentist is not only much more effective, it's also cheaper than uses these substances several times.
But it's not dangerous to do it by yourself, or?
No, this is not dangerous. But what is dangerous is to use household remedies, like some do baking powder or strawberry mush or something like that. This is really dangerous because it damages the enamel.
So no household remedies, but then what can you do if you don't want to bleach your teeth for whiter teeth?
Then you have to use conventional techniques, mechanical techniques like polishing the teeth. But of course, with every time of polishing, you take away some of the enamel, so you can do it only a limited times.
So sounds as if bleaching is really your best bet there?
Absolutely, yes.
Receding gums is another problem that people might see for their smile, so to say. What can be done about that nowadays?
Gums you cannot correct with bleaching, but you can use special, small but very elaborated types of surgery to cover them. Yeah, of course, it depends on the skills of the surgeon and on your own behavior. For example, in smoking patients, these techniques don't work.
Dr. Sader, there are a few methods to resculpture your teeth, like composite bonding or veneers. Is there one that's better than the other?
Composite and ceramics from the veneers are different substances, and they have different advantages and disadvantages. Composites are more used for filling of caries defects. You can have very nice aesthetic results. The endurance depends very much on the quality of the material and by this on the price. But you can achieve about 10, 12 years with a composite. Every time that you have an area you reconstruct which have lots of loading forces to bear, then you have to use ceramics, veneers, like in the lateral parts of the teeth.
And they're more expensive. That's why you mentioned the price, right, than the composite.
They're more expensive, but also they have a more longer endurance time. So a ceramic can be used for 15 to 20 years.
Well, that was exactly what our viewer Robert Carlson wanted to know. How long do they last, and do you have to take special care of veneers or composite?
Yeah, as I told you, about 20 years can be achieved with a veneer, but you have to take care for them because there could be some caries development beneath the teeth or some discoloration, and therefore you have to go regularly to control to your dentist every year.
But what about stains, or are they more prone to breakage than your own teeth?
I think they have a similar quality like your own teeth, but the best substance, of course, is a natural substance, so it's the tooth himself.
Mm-hmm. These methods, veneers or composite bondings, they're quite expensive. Do you think that they might become cheaper in the future when new materials are being developed?
I'm sure on this, because there is a lot of development in this field. Many companies working on producing new materials, better qualities, and I think we will have much more price reduction in the next years.
Mm-hmm. So something to look forward for there. If you need to straighten your teeth, which method would you recommend for that?
If you have only a small problem, then you can use a simple composite reshaping of your tooth. But if the problem is more severe, then you have to go to an orthodontist and to use bracelet therapy for this.
Mm-hmm. And these braces, there's many options nowadays. There's even invisible ones that you can wear. Are they harmful to the teeth in any way?
Normally not. The problem is that with the invisible ones, it needs more time, the treatment. Yeah, and time is money, and again, this depends on your personal benefits, what you want, what you like more.
Mm-hmm. Okay. Well, the best option, you said yourself, is to keep your own teeth in really good shape. What's the ideal daily routine that you should get into to keep your teeth really white?
So the best is to brush your teeth, of course, not immediately after eating, but about 30 to 60 minutes after that. To use a toothbrush, which is not too hard, and a toothpaste, which not creates too much abrasion of the enamel.
Mm-hmm. And flossing, I guess?
And flossing, very important fact you mentioned, that you have to take care for the interdental space and to clean it very closely, very carefully.
Okay, well, thank you very much for your time. Thanks for being our guest.
Thank you very much.